So there's two people who are not listed up here. Krill, who you actually heard talk about blockchain, that was this much over every single person's head, but it makes a lot of sense. And Juby, who has done a lot of stuff on, we'll call it on the payer side and blockchain, which is kind of exciting. We're going to make this really interactive. Guys, ask these guys questions. I mean, across the board. Big time investor, really cool, has done a lot of amazing things. Probably the most famous healthcare related blockchain organization in the space, Burst, and what they did with Intermountain. If you sit on your cell phones and you Google the press release, it's pretty freaking amazing to me. This guy, Lenny, is at a small institution called Hospital Special Surgeries, has been in the healthcare space for a long time. What's even amazing about him, he's not a healthcare administrator. He started out as a nurse. He's also an incredible inventor, and he's done a lot of companies. So you get to go, hey, Lenny, how does this really play practically? All right? Then we look at this lady, Lexie, right? Not only she advised companies on marketing and go-to-market, she's helped more companies than anyone on this panel on creating ICOs, right? So awesome person to know, right? And then we talked Juby, which we mentioned before, for the payer side. Now Krill, obviously, can actually design the blockchain for us and make us all go to sleep because it's so complicated. And then Charles, creating a crypto hedge fund that is going to launch very, very soon and is raising a lot of money, which is pretty amazing. It revolutionizes everything. So now I look at this panel, I go, I am kind of humbled to be here. All right, I want to just go down the line really quick. You can introduce yourself, drop about your company, no more than 30 seconds. Why are you excited about blockchain? Say who you are and then why you're excited about blockchain. You're first, you need a mic. And if you don't have one, here we go. I feel like Phil Donahue.
You guys hear
90% of the audience
yeah.
don't know who he is.
David Drake, got my own family office. We got involved with crowdfunding and the Jobs Act 2011, and have a long history in building crypto, and now have maybe 30 different altcoins and holdings in several millions in the space. And we're LPs and GPs and funds, hedge funds and venture capital funds in the space.
Think about it, that's amazing. All right, who knew you existed, right? Now, Frank.
I'm Frank Ricotta. I'm the CEO and founder of BurstIQ, and we're a health data blockchain company, and we have solutions that are B2B oriented. So we have solutions for providers and large hospital chains, as well as B2C oriented for individuals and employers. So you asked the question, why am I excited about blockchain? Everybody says it's disruptive. I don't think it's disruptive. I think it's foundational. And foundational in the sense that I think it's going to radically change existing social, political, and economic systems in a way that we have yet to truly comprehend. And that applies to healthcare because it's going to democratize data within health, which I believe is the wicked problem in healthcare.
And you're not just in blockchain, you're like embedded in the block.
Yes.
We'll get into more of that. Lenny?
Hey, I'm Leonard Achan from Hospital for Special Surgery. We're the musculoskeletal health #1 orthopedic center in the world. So why am I excited about blockchain? Primarily because of its ability to be a technology, I agree with everything Frank just said, its ability to be a technology architecture that you could build upon to increase transparency, interoperability, and a ton of things that are elements to the healthcare system today. So I'm excited because it's still early. The entrepreneurial community, which I have faith in and which I work within with my role as a Chief Innovation Officer, I think will continue to fix problems for healthcare. So I'm excited about it from that perspective.
Awesome. Lexie?
Awesome. Hi, I'm Lexie Kier. I work with startups looking to scale and grow, specifically in the fintech and health space, and take a lot of companies through ICO. I think the reason blockchain is the most exciting, I'm working with a couple of large companies, one in health, one in telecommunications, and one is a large credit card company. And I think the way that it's forcing infrastructures to streamline is totally foundational, to Frank's point, and is streamlining a lot of the way that we handle data. It's not just about money or currency. It's also about creating really, really streamlined, elegant systems to allow data to move easily.
It's awesome. And before we go to Juby, now, when we talked about before someone doing ICO and all these advisors on their board, these are the 7 you want on your advisory board. All right, so if I was starting an ICO tomorrow or a blockchain company, I want these 7. All right, Juby?
Hi, my name is Juby Georgewaze. I'm the CEO and Chief Innovation Officer for Globex Health, which is a company I started last year with a few nurses and doctors. And I am a nurse like Lenny here, and I have about 20 plus years experience, including 15 with the payer side. I stumbled into blockchain 2 years ago. It was not something I originally from India, so there was a request to help a company out of MIT with helping farmers in Afghanistan, Pakistan, and India. And coming from a farming community in India, I was like, all right, I'll help you. I didn't know that I was working on blockchain at that time from MIT. I didn't. And that's how I ended up in blockchain. And I ran into, like, in the blockchain community, the Federal Reserve is in there right now looking on what to do, because that's the VPs, several ones are there. One of the organizations that I belong into the revenue cycle, that's national, I was on the board meeting coming right out of a cryptocurrency event, and I was just complaining about the Federal Reserve, and they're like, Juby, why don't you do something about blockchain in revenue cycle, because we don't know what it is, but I think we can help it. So I was like, all right, let me see. And Carol was kind enough to help me with putting together a presentation for this, the revenue finance community, a lot of CEOs, CFOs of hospital systems, and insurance companies and employers who are self-insured. There is a way for them to use that as the instant payment. So you as a patient would know how much you are owed. You don't get a bill after. You know exactly how much it is. And the doctor who pays or the hospital will get paid right there and then.
All right, so we're not going to introduce these two guys because we did it, but I just want to start with you on that. It makes me think, do you think payers will embrace it? Will the Aetnas and the, so on? You're very confident about this.
I come from that world. I have designed some of those products, and I know what a pain it is to go look up United Nations or contract up and say, really, there's a transgender that you can do transgender, like you can do certain procedures, or how much does it cost? How much are we willing to pay? It's not easy. It's documents and looking it up. Why can't we have a smart contract that is automated?
But Juby, is that 10 years from now? Is it 5 years from now? Is it
It's actually retrofitting all the advancements already taken. All the insurance companies had to go through electronic advancement as part of the ICD-10, all these things that we have done. So there are ability for some of the contracts. If it's an old 20-year contract from IBM, may not happen, but newer ones, yes.
All right, so Lenny, the other side, so the institution, are they going to embrace it? And more importantly, are they ready? Or will they ever be ready?
Yeah, I think Frank's proved that there are some, forward thinkers in the country. I think there are anomalies right now or unicorns. I think in the provider space and for the entrepreneurs and everyone in this room who's been in digital for a long time, it's been an uphill battle, right? And that's because what this brings is, crazy words like transparency and accountability and trust and, the self-preserving side and the, fear, the ignorance of healthcare executives could create fear. And if they create fear, they could put barriers up and bottlenecks up. So agree completely. I think that it'll infiltrate. I think that it'll break through. When I think of it, I think of blockchain as just an ingredient. It's an ingredient that could be wrapped with other technologies to improve efficiencies and create, trust and establish a lot of new thinking in the entrepreneurial community. When that comes to the provider, I fear that there'll be a lot of pushback. Right. I do think though that from the speed that it's moving at, and from the from crypto kind of bringing it up, that could be a pro and a con. On one side, it could add fear and ignorance, and then, it's up to us to start to educate the provider side to embrace it. And I think it's really important that the entrepreneurs not just lead with blockchain as it being the entire meal. Again, it's a simple ingredient that we have to embrace.
And anyone on the panel, if you want to jump in on anything anyone else says in the panel, let's do that because that makes it really exciting, interactive. But before you jump on, because let's do the other side of healthcare. All right, so Burst, all right? You told everyone about, Lenny's impressed by it, everyone's talking about it. I mean, Intermountain paid attention to what the blockchain and how it can save, my number's going to be wrong, $89 million or something crazy like that.
Yeah.
Why did they embrace it? I mean, and why were they forward thinking where traditionally healthcare has always been a couple steps behind. 10 years ago, there was no such thing as a chief innovation officer at a hospital. There was no healthcare system that invested, and now I don't think there is a real institution in the world that's a healthcare that doesn't invest. Why do you think that they were fast moving into this?
It goes back to that data problem.
Yep.
And there's two aspects to the data problem that's traditional, which is access and understanding. Both are key, and both are very tough. And data in health is very, very dirty. So all you digital health companies out there, you know how hard it is to connect to a system and then even translate how they program everything, even if it's Epic and Epic. That's a problem. So they saw an opportunity to solve that problem by driving things into a common platform with all the features we talked about, immutability and being able to audit, and then replicate it for other systems. So that's what we're doing with a company that they spun out called Empiric Health. They're going to replicate it to a number of large hospitals, and we have others coming on the platform. But the other part of it, when you start forward looking, data in health is currency.
Yep.
It's currency. Data about you, how you feel, what you do is the currency that's driving the next generation of health and health engagement. Not just when you're sick and you're at the hospital, not just when you're seeing your doctor, but every day and all the time. And the ability to capture that in a longitudinal view makes the quality of interaction a heck of a lot more meaningful, as well as it lets you do stuff with your data. Putting you back in control of your data will fundamentally change our health delivery system from an economics and cost perspective, and they recognize that, as well as some of the other leading providers starting to recognize that the relationship with you is the most important thing they have on their agenda.
Awesome. So now, David, I'm going to jump to you and to Charles at the same time. Lenny, can you give him the microphone? So as an investor,
Yes.
when you hear health,
I want to talk about a couple of case studies.
That's what I'd love you to do.
We have about 40 different investments in altcoin and pre-ICO.
How many are healthcare?
Actually, at least 2.
Okay, good.
I can only remember 2 right now. I'm going to use some examples. RoboMed out of Moscow, a young entrepreneur in his 30s, got 6 hospitals, about 20,000 square feet each. And he realized that in Russia, he's getting a lot of clients who are the kids of the parents who are not insured. Good 40% of his revenue is coming from there. So he's using blockchain technology to do the back-end solutions, and he's only wanting to expand into developing countries. Doesn't want to go to Europe or the US because it's too efficient, too much competition. But the uninsured, without insurance, is where he's expanding into. So he's running around now, around Europe and Asia, raising capital for it. But I kind of like that blockchain on the back end. It's B2B. The consumer doesn't see it. And he's finding out that his clients are, the kids, booking an appointment through the phone for the parents and walking them into the hospital, paying cash. So he wants to make an efficiency right there. A beautiful little solution that, I wasn't aware of. And he's seeing an opportunity in it. Another group that I'm working with and took a stake in is Solve Care. Now, Pradip Goel was his chief investment officer for Blue Shield Blue Cross. So he has quite I'm on the board with him and, congressmen and some other people on it. And, he saw the shortcoming in the insurance business in the healthcare. And he's going out in a big way to change that. And he didn't pick blockchain to find a problem. He had a problem, and he felt that blockchain allows that forensic accounting system to track everything properly. Going back to, RoboMed, the payment system on the back end would be, hey, this person, you can only get paid if you do this solution in the hospital. So you're not going to get your arm amputated by accident because that's not what it's being paid for. So that gives you another way to, make sure there are less mistakes in the system. And also the blockchain allows you to transact instantly. There's no invoicing or collection. It's paid instantly. That's a part of the smart contract, which makes that more efficient. So as an investor, I'm seeing more and more in this space, but it's hard for, the crypto community to embrace this. Because, this coin with Satoshi, Bitcoin started in 2009, it was for the anarchists, for the libertarians, for the ones saying, hey, we don't want government to control it. It's for the people, for consensus. Now it gets diluted, you see on the news all the time because we're trading it. I mean, I work with Charles, and we're friends, and I see that everybody's asking me, well, it's a bubble, it's not a bubble. Well, I think we need to look at layers. It started out as a software solution, decentralized. it didn't start out as a trading speculative opportunity, but now we see foreign exchange people jumping into it, and traders and hedge funds, and they're trading it,
Right.
and behaving differently for what the intention was. So I think we need to look at it at different stratas of what is going on.
So in your career as an investor, right, obviously you didn't start off in investing in crypto. Is this the coolest time?
Yes, it is.
Yeah?
It is the coolest time.
Right.
I mean, I'm advising and invested in so many,
Right.
so I get to see behind the doors
Right.
of the failures, successes, the players, where they incorporate, where they start, where they go, the regional players in Japan and Korea and China, because there's a language issue and barrier, versus Russia and Europe. And, I get my finger on the pulse what's happening globally.
Awesome. All right, I'm going to come back to you in 1 second, but now I want to jump to Charles real quick. So pile on. What are you looking at? What do you think about the investment part of this?
Yeah, and I would add that.
And I didn't know you guys were friends. When I picked
Yeah.
the panel, I thought I was doing some matchmaking, and I wasn't.
I would say the crypto world is still very small,
Yep.
so we all tend to know who's in this world. I would say that I think what was said earlier was that your data is like a form of currency, right? And so I could see how this can be used with medical records, where you have control of your medical records. So then when you go to another doctor, you don't have to do another x-ray or another procedure. Like, they already have everything, right? Because you give them access to it. And also, just transparency on how much is it going to cost for me to go to a doctor.
Right.
I think one of the issues I always encounter, I have kids, go to the doctor, they can't tell me how much I owe. They send me a bill afterwards. And sometimes it's shocking what the bill is. So that's where I think blockchain can be used. But also, I think what David was hinting at, I don't know if you caught it, was that a lot of times the best systems are the ones where you don't even know the blockchain is being
Right.
used, right? There's a company called BitPesa where it helps you move money from here to Africa really cheaply, like very low transaction costs versus Western Union. And they use Bitcoin.
Does it work in Zimbabwe, by the way? Does it work in Zimbabwe? You don't know.
Oh, I actually don't know. I know they have certain countries.
I want to look at that if it does.
Actually, that's a good
I
question.
do send money to Zimbabwe for some reason.
Okay. You know what? I'll check that now. I know it's certain select African countries, but they're using Bitcoin, and you would not even know it, right? And I think that's where the development of this technology is important, in that the user experience gets a lot better.
That's awesome. And I love that I have the two financial guys who have all the money on the two ends. And before we ask you a question, I got to bring it into the middle of Lexie. So now, Lexie, all right, they found some ideas that they like. We're gonna come up with an idea to do an ICO. How do I do it, and why? And how important is a white paper? And is it as important as it used to be? And what do you advise someone? I have this great idea. Before I go see David and Charles, what do I have to do?
So I think we just. Oh,
And before I
don't
fall.
off the stage.
Which would be actually
You
kind
too
of.
moment.
Yeah, I mean, white papers are extremely important. I think everybody needs to understand that ICOs are just a new type of funding. It's not, this isn't like revolutionary. A couple years ago, this whole bubble happened around crowdfunding. Right. This is basically just a different version of that. So I think once you realize that, the fundamental thing is, what is your value proposition, and literally what is the offering? Like, why are you even on blockchain? Does it need to be? Charles was saying some of this. It's terrifying to see some of the typos all over different white papers. I also have a development background, so I actually look at the code base. A lot of them are literally forking Ethereum and adding on a little something, and it's not unique. So it needs to actually be using blockchain for a particular utility. It's not worthy of investment just because it's something that's somehow related to blockchain.
And to David and Charles, can you raise money on and Lexie, and anyone on the panel, can you raise money on just a white paper anymore?
Totally. I mean, I have a client that did a $9 million, white paper only,
How long ago was it?
like 6 weeks.
Oh, okay.
I mean,
Wow.
it's totally doable.
Okay.
But they're a really amazing company. They're actually connected to healthcare.
Were they an existing company before?
No.
Okay.
And
Wow.
it's a great case story. They're called Modem, and they basically work with IoT. There's a strong application to healthcare. They have a lot to do with sensors. So you can basically track the temperature of the particular use case within healthcare is they did a beta with a bunch of containers and ships trying to make sure that really expensive medicines that are being sent overseas don't cross a certain temperature threshold. The idea being that the efficacy drops dramatically. So if you're getting a shipment of incredibly expensive medicine at a hospital and you're about to give it to patients, can you have some sort of an app that shows you literally the temperature over the past 6 weeks that it's been on the sea? That's a really strong use case. So that's a great example of a company that has healthcare applications. It's touching IoT. I get really scared when I see things that just drop blockchain as like their key value proposition. Blockchain is just a platform. Like this is just a new system. I super advise all of you guys, if you haven't, to actually look at what a blockchain is. Krill probably can be super helpful here, but literally it's a chain of blocks. Like all the data gets saved in a new block. So it's something that updates constantly and is uncorruptible, and it's everywhere. So it's this new distributed storage approach that will drop all of your cloud storage that you're paying to Amazon or wherever now could be distributed. But once you sort of understand that that as a buzzword isn't important, then there's some interesting things.
I want to add to
company
that,
on white
Lexie.
paper?
Yeah.
Back to your question. I had this question asked to me a couple of days ago. I was on the board and took a stake in Embrosis, who raised $35 million over the summer. They're pursuing the same area of Internet of Things for medicine being tracked from beginning to end. Pressure, light, perforation, temperature,
really
et cetera.
sophisticated stuff that
And I
they
think there's
do.
space. The question was, how many companies can do the same thing? Here's somebody who may raise $9 million. I think you can have, maybe thousands of companies one day doing just the supply chain. I'm talking to a trucking company who want to do the same thing, Internet of Things. You have food, that's endless, freight forwarding. It just keeps going, and it's regionally based.
Yeah, I mean, Mondelez and I think it was Dole and Mondelez, a couple of large CPG companies got together to create a supply chain basically to make sure that when you get your Capri Sun, you can track if there's a recall, exactly where was that Capri Sun,
Right.
In the entire chain of where it's been, can we follow it and make sure that we know what batch it came from? So there's definitely going to be competitive, offerings in the same kind of area. They all are shaking out really what they do, just like any new company. So I think it's just about execution on these ideas.
Julie, jump in.
So the only thing in healthcare, we have to remember what Kirill mentioned in his presentation earlier is what is driving is, and what allows Intermountain to do what they did is HL7 fire technology, which is the United States government has a 10-year, U.S. Office of U.S. Government IT, ONC, have a 10-year plan, and you have to comply. Intermountain runs the back end of Epic and Cerner, two main EHRs. So whatever happens Intermountain gets carried into the Epic and Cerner world.
Frank's smiling.
So Epic is now going to go into revenue cycle billing. They're starting to try it.
Frank, anything you want to add?
Yeah, well, I think that's a fair statement. There's a lot of established standards within healthcare in terms of access, and ONC has been trying to deal with the interoperability. And part of their approach is, hey, I'm going to standardize all the data elements, which I believe will never happen. So you still have to deal with that from a different perspective. But reducing the friction in terms of data exchange and data access is where a lot of what we're talking about fits in. It's the data between systems and pulling data out of those systems. But I think it's also important to know, we've been talking about blockchain as a piece of technology. Too many people equate blockchain to an actual currency, like Bitcoin is blockchain or blockchain is Bitcoin. That's so far from the truth. Our blockchain is one piece of technology. That's not true either. Blockchain is really a way of doing things, and an approach and a philosophy for doing things that really democratizes a lot of things and transactions in many ways, and changes the whole trust relationship between individuals and between organizations. And I think you're going to see a lot of changes in the technology itself. You see a lot of these guys that were successful with their ICO are focused on the protocol layers within blockchain, and you're going to see a tremendous amount of innovations. But I think you'll see the biggest companies emerge at the application level that utilize this embedded, that it's transparent, but it lets you do something that you just absolutely can't do without it.
Krill.
Right. So this is for the second time in human history there is a technology can drive social and economical aspects of our lives. And when we say blockchain, that's a little ambiguous because there are two different terms: distributed ledger technologies that typically have been used by financial organizations, and blockchain, which is cryptocurrency. So we have to make this really clear and separate our technology from tradings and investments.
Awesome. I want to take your question, but first I want to ask Lenny a question. So all day, every day at HSS, part of your job is people come and they pitch ideas. Why you should either invest in my company or why HSS should actually use us in their workflow. Have blockchain started coming yet? Do you see it? Are you starting to get a hint that people are going to start coming? And again, not using blockchain as blockchain, but crypto-type companies.
Yeah, it's trickled.
You want to give them a mic?
Yeah, it's starting. It's trickled in. I'd say 3 or 4 companies over the last 2 months have approached. And again, you know, I stand in the fray. I stand between two cultures: the entrepreneurial community and the healthcare executives. And you know, the big issue here is about education, translation, and helping not me and not my team, but the rest of the organization, the rest of the C-suite, understand and accept it.
Wow.
And I think everything that you're hearing up here today, you know, talks about not putting it at the front and center as well. So some of the companies are doing that, and it's making executives react. That's my biggest fear.
All right, another tied-in question. You don't have to answer it if you don't want it. If you took the 10 biggest hospitals and hospital systems in the country, how many of you think are sitting in a boardroom like today or any day even talking about this, or is it not even there yet for the most part?
I don't think at the executive level it's there yet. I think, you know, we've seen with what Frank's done and a few others, we've seen 1 or 2 good examples out there. But a conversation like this, or even a fraction of it, isn't happening. So, you know, that's one of the downsides of it being new. It's also one of the most exciting things because it'll release innovation and creativity within the entrepreneurial community.
Charles, jump in real quick. I'm sorry, then.
Yeah, I just want to add that I actually know someone who's an executive of a Fortune 500 company, and they're talking about it, but they don't know what to do, right? That's really the big issue right now. It's still so new. There's a lot of risk with it. Also, when you hear about Bitcoin, a lot of people still associate with Silk Road, drug dealers, like hired assassins, so it has that negative connotation, right? Yeah. And we got to veer away from that, right? Like, and I think that just takes time.
But that's also the biggest opportunity, right, Lenny? I mean,
yeah. The other thing is, you know, to what everyone's talking about today, there's a loss of control, right? So again, I'm standing in the middle. I'm speaking from both sides, right? But for healthcare executives, for institutions, for their, you know, GCs. Right? And the risk side of it, you know, what this is saying is we're going to give up control. Yep. That's scary to the traditional healthcare environment on the provider side. And if anything's proved that, it's been the last 10 years of digital companies pushing boulders uphill to try to change things in the provider space.
To just follow up with Lenny.
And can we get a microphone over here? Just
the state of Illinois put their Medicaid already in blockchain right now. So the Medicaid pre-certification and credential is completely on blockchain right now. State of Delaware, Medicaid also did blockchain. So you have to realize that there are a lot, FDA and IBM Watson blockchain already on those drug trials or approvals. So there's so many blockchain work in the background. That is no cryptocurrency, no Bitcoin, just the technology, which is these databases or Excel spreadsheets that you imagine are talking to each other. They're updating all at the same time. That's it.
That's a great answer. And I also think the reason why I think it's going to grow faster in healthcare than, let's say, digital health grew is because there's a financial element to it. Where digital health, it was like, all right, why am I going to do it? Oh, it makes life maybe easier. But all of a sudden, this whole world of crypto is, there's a financial upside, or potential financial upside, which makes people in the C-suite pay attention to it. Because if they're not invested in it like they are in the stock market now, I could actually make the bet within the next year to 18 months, most people of any wealth are going to be invested in it. At least that's my guess.
And I think you're totally right. I mean, it's going to come in through finance, operations, rev cycle. That's going to be where it infiltrates the provider space, and then we'll see how it moves through the clinical
What makes
arena.
David and Charles so happy? All right, ask your question.
Awesome. I'm going to stand up. I'm Cheryl Wu. I'm a physician here. I've been thinking about this for literally the last year, and I've been looking for blockchain experts, and now I have 7 of you in front of me. So from a physician standpoint, and I have to go in 15 minutes, so this is like a free-for-all idea. From a physician standpoint, it seems like the problem in this system is that the sickest people who need medical care don't have the money, right? So instead of using Bitcoin, I was thinking maybe we should start a system called HealthCoin, which actually correlates with the degree of illness. Anybody who's ever run an ER knows that the most amount of resources, money, and women and manpower goes to the sickest patients. We don't do that in this country, right? So I'm thinking instead of a cryptocurrency, which is equal to money or finance, we actually have a health currency, which is equal to the degree of illness per patient. Because you really don't need a doctor when you're well. You only need a doctor when you're sick, and most people, when they spend money within their life on healthcare dollars, it's really the last 6 months of their lives, right? So I just want to ask you
I
guys,
just want
what
to
do
interrupt
y'all
for 1
think?
second. So, Frank,
Yeah.
isn't that really what, I mean, not exactly, but isn't that what Burst is going to enable you to do if it's on 80 million phones?
Yeah, I mean, we actually created a cryptocurrency. It's not fully released yet, but we have a relationship with one of the largest mobile carriers to put a crypto and a health wallet on a phone to let individuals transact with that. And we tie crypto to data and data value. But the other aspect of that is the social impact side of it as well. Yes, I can allocate more quote tokens to individuals who need it, and I can do it as a person in addition to the system itself, and lifting each other up. And I think in this world we can change the fundamental payment and economics of health. Why? Because we're empowering the person and people to make decisions and let resources and access flow to those who need it. That's the real long-term change that this enables.
So the only thing is you have to
Use the mic, if you mind, real quick.
Yeah, physicians are critical.
The only thing is you have to partner with physicians, because the main people who can decide whether a patient is really that sick or not is a doctor or a nurse, or but somebody who can have that triage ability.
Yeah, it's about making it personal again between the physician and the person. If we can do that and we can enable that, then we start changing the
As a
curve.
nurse who have done the analytics and the whole these design and AI work, I would say it's already, the base work of what you need is already available, which is risk scores. Where Risk is a good company that everybody buys a score from on every human being in this country. If you ever had an insurance, health insurance that is, or HCC score, which is what Medicare provides on you, so that you are X times more higher risk for healthcare cost.
I just want to add to that. So because I'm on the opposite end of that, because it's been used by payers to determine what your premiums are going to be and what you will and won't get. I don't think that's right from a lot of perspective. I think using your personal health score and health profile, if it's yours and you're able to transact with it, can fundamentally change the economics of the
I humbly
system.
disagree from the payer side, having done all these analytics, because payer is the one who pays for everything. They get all the data, not just Dr. 1, Dr. 2, Dr. 3, or the Florida doctor.
They get the data for the person that they're covering, but they don't get all their data.
Goodness, all right, so I'm going to interrupt you guys, 'cause we want to
there's a middle layer.
we want to answer more questions, and we will schedule the cage match and a debate afterwards, and the winner is going to get funding from David or Charles. So that's where we're going. Right. But when you come up with your idea, you go to Lexie.
I need to write a white paper.
You go to Lexie, hire her company to help you with it, then present it to these guys on the end, and then after it's done, go to Lenny's company or his healthcare organization and present it and see if they'll do it, and make sure it's up. All right, let's hear your question.
Okay, my name is Francie Grace. I'm here as a patient advocate, and I'm also here monitoring everybody's comments on Twitter. So I have 2 questions from me and 2 from the audience. And the first one is to David, right?
Yep.
Yeah, how do you think this will improve accuracy? And Frank, how will this help the big gorilla interoperability?
Well, let me start on that. Back to basics, I guess. We have a software that says, we will pay you when you do this, and automatically it goes into the smart contract. So the accountability in the government is built into the software, and it makes it much faster than skipping all the middlemen. Is that the question?
No, what I mean is when the medical record says cut off your left foot, but it's really the right foot. stuff like that, errors in the medical record.
Oh, so you think will it help accuracy?
Will it help accuracy?
Totally.
You were mentioning that you thought.
Yeah, the
it might
blockchain
help.
would say, the blockchain, this is paying for this service. And unless you do that right service, you're not going to get paid. So it's written into the software. But the human error would be always the person, the human being who reads the documents and cuts the leg off.
So pretty much the same.
Yeah.
It's neutral on that. Then, so Frank, what about interoperability? The thing that everyone argues about all the time, and we all have our favorite villains.
Yeah.
It sounded to me like you thought maybe this would help with that.
Yeah, interoperability is access and understanding both. And so a lot of the traditional players out there who are making a whole lot of money, health IT is $1 trillion business, have a vested interest in maintaining their data islands because that allows them to control and manage their customer base. I'm not talking about the hospitals and providers. I'm talking about the vendors that support them.
Yeah.
The government can push for change, and there's meaningful use standards. That's going to happen. The hospitals themselves can push for some change in interoperability. We see some good examples of HIEs. Certified health professionals, there's 1 million plus of them, can push for change. But there's just in the U.S. there's 350 million individuals. So if we can get what's relevant to you as a person and have that data that's a longitudinal view over time, that's going to solve a whole lot of interoperability problems versus the approach is I'm going to create one big massive database in the sky. I see a future where each and every one of us have our own personal health blockchain.
All right.
And
so-
doctors would consider that to be the record.
The record, because they're putting data in there. And it's
Before you ask
certified
your
to
next
take data.
question, let's just take one more from the audience because
This is from the audience, actually.
physically here?
Yes.
Oh, all right. We'll do one more, then we'll get because.
Oh, go ahead.
Well, no. Right back there. How many minutes do we have? 5? Then,
Yes.
right, you want to stand up? Yeah. And we got to get you a microphone. So you know what? Hold it. 1 second. I'm going to help you. You got it?
Hi, my name is Dr. Carol Sarkisian. I'm an emergency physician. My question is this. So if I have this blockchain of information, is it organized in any way, or is it just one thing after another and I have to go through all of it to figure out what's going on? Or is it something that has notes here, labs here, procedures
Answer.
here?
So government has put a framework on it. It's called HL7 FIRE, and that's what blockchain and YIPIC, everybody's going to have it follow that format. So it is organized in a standardized format going forward, not back.
It'll be just like your average EHR or whatever, Epic or whatever you're using, but it'll have forms that are not faxed in where you can't read things. It'll be a more digitized update.
Yeah, but blockchain doesn't solve that problem. Blockchain in and of itself is this long data file like everybody talks about. It gives you no real advanced data capability in terms of data analytics, and most people that are dealing with health data are putting it off chain and writing validation hashes back in the chain. That's going to change over time. We're doing some of it where we're actually putting it on chain, but some of the protocols will allow you to do it in terms of a structured way. But again, it's a very, very dirty system, and I think you're going to see things accelerate faster on some of the machine learning and semantic learning and structures that allow easy access and understandable access to that data that just doesn't exist in common data protocols.
Great answer. Question?
So Frank,
And again, I'm speeding you guys up because I want to get as many questions in our final
Frank,
5.
this is based on something you said.
Who's it for?
For Frank.
Okay.
By the way, Dan Piakaj with DataArt. So I agree with you that each patient having a longitudinal view of their patient data on a blockchain is kind of like, it's almost the moonshot in some sorts, because then you can do all sorts of things with it. For instance, give it off to pharmaceutical research and let them access it, and maybe they pay you. It could be all sorts of things done on top of this. But to do that means that everybody has to give up their data, and it has to become a public blockchain. Who's going to maintain it? Who's going to actually pay for that, and how's it going to happen in your view? Because it's not going to be one company owning it. It's going to be millions and millions of nodes out there with duplicated copies of everybody's data.
Yeah, well, I think
Right,
I think you hit some of the fundamental problems in existing implementations of the technology. All the data is replicated across the chain, and I think that's going to change because there are two things that we address from a technology perspective. One is how do you deal with multiple security zones within a blockchain and access to that data at multiple levels without having to fully replicate it across the entire environment. The second is how does it run like a big NoSQL engine instead of a big flat file database? And when you start democratizing it and shifting the ownership of it and how it's represented, who runs the internet all by itself? Nobody runs the internet all by itself. Yet we've seen these tremendous applications get built on the internet, all the way from e-commerce to these massive social networks, and I think that's what blockchain can enable.
Perfect. Next up. And you can,
I just want to throw, this is probably what Carol said. There are three types of blockchain. Bitcoin is public. Then these private equity stuff that Carol have a lot of exposure to is private. And then healthcare, it's consortium. It's a hybrid where a group agrees to join a private network.
There's different permission levels, so
Exactly.
it wouldn't be like all the data is pooling somewhere.
The patient has to be the one who owns the data in the end for it to work right. As an organization, you owning the data doesn't get me close to where I should.
We don't live in hospitals or doctor's office. You have a whole lot of other data. It's got to be, when we talk about it being transparent, to the system, it's transparent to your life. When you use your phone, on some of the apps, do you care where things are? You don't care. I mean, most people don't using the app.
Right now, like if you're on
Using the
Wi-Fi,
app.
that's a question about where your data is. I think all this is going to get shaken out as regulatory starts to make
Good answer, Lexie.
rules around how patient data is handled. You might actually end up using your data as currency. You may choose where you're trusting this, but not that. It'll all be something that you can
the
choose.
chain was technically created for trust, right?
Yeah, and there are solutions out there to solve this. I'm working with the CTO of Microsoft in Europe.
It should always be the
He's
case
doing
with
validation
right?
solutions on how to do it privately.
So here's a question. I mean, we got a question there before. Does this?
Data, then nobody else can really do anything with it without their permission, which in turn.
But right now,
That's
you're
where it should
faxing
be.
a doctor and asking them to unlock a form, and then faxing another doctor and asking them to take the form. Like, this is just a streamlined way of enabling
Right
that.
now, they can basically take that data, de-identify it, and sell it. In a situation where I own my data, and you're not allowed to do that, it changes things totally.
So it's the way it should
From
be.
technology standpoint,
You have multiple owners of data in the system. That's a fundamental complexity.
What you said about the internet, Frank,
Yeah.
and I think that's where it's going to head. It's that's probably the end game.
Yeah.
So I agree with that. But
I think that's my next panel, is what are we going to do with data after we do the cage match? And then before you answer, and tell me if I'm wrong about this, I think the only successful chain out there is going to be one that's sort of open, that there's APIs that anyone who comes up with another company, it's all going to go together. It's the only way this is going to be successful.
So the United States government requested white papers, and they accepted 6 of them. They're going to use that to develop a framework on how it should be, the blockchain, ONC, healthcare, IT, GOV. The second thing is United Nations also have gotten involved in the space and have decreed, or whatever you want to call it. There's something out there that my company is doing the private thing of it is based out of that. So it's international.
Really cool.
Great. Shameless
we
plug.
end up in the world when there are multiple blockchain implementations and multiple protocols. Technologically, there are ways how you can transact with 2 different or 3 different types of blockchains. It could be side chains, but this is possible.
Great. All right,
So,
your question?
and
then you'll take you as the last one.
Life
So-
science.
Will you stand up? So we
Yeah,
can-
very quick question.
Who are you?
Adel Lawi, and then technology licensing at the University of Princeton. One of the things I think I'm just really curious, and it's really pity there's no regulatory person there, or unless I think there's somebody that you can actually speak up. Because at the end, if you want these large adoptions anyway, I think you cannot replace the FDA, right? For example, in the medical side. If you don't get those guys, to endorse wherever I think this new platform is not going to work, especially at scale. So perhaps it's for Frank or Charles, how far are we, to get like this endorsement, this buy-in from these regulatory bodies?
All right, Charles first.
Yeah, so I would say a lot I think regulation is the big thing, right? I think even when I think in the investment side, people are scared of regulation. Regulation can actually be positive because it can guide us in the right direction, right? And that's what I'm waiting for. The problem with regulation is that they're more reactive than proactive. So they're not. The question is, how big of a team do they have that's working on blockchain and different regulatory bodies? How big is their blockchain team, and what are they thinking of? Are they thinking forward? Because this is very clearly going to change the world for us. The question is, how is that process? What is that path? How are we going to get there? And I would encourage regulators to come forward to talk to people that are involved in this space to understand what is the right direction for this. And I hope they're more proactive than reactive.
And you don't think regulation is bad?
No, I don't.
Right.
I think it's actually very positive for the industry.
Which is sort of anti what a lot of people are doing in this space. Do your question real quick.
Thank you. Dennis Latero with Metamorphic Systems. My question is kind of a tangent on what we're talking about here in healthcare. If the patient owns their data and it requires permission for that data to be shared, is that something that can be, if you will, bled back into consumers so that all of the data that Google and Amazon and everybody else owns on me or controls from me, do I get a chance to own that data now and be able to monetize that if I choose to?
I want to approach that first. So I'm involved with quite a few platforms, marketplaces, artificial intelligence basically. And, artificial intelligence will be as good as the data you get in. So the marketplace is based on you have your data and you decide who can get access to it, what data, and you get compensated with a smart contract on the spot. So let's say, we have some conversation with Verizon and you're taking a Uber in Midtown at 6 p.m. You might want to say, I want to get compensated for anybody who's looking for a male taking Uber in Midtown during the week, and I want to get compensated through a token. The same thing I can see applies to this. People will give permissions, and it's immutable, and it's instant rewarded with a token. I will give it to my doctor. He has this permission to use this data. He may be trusted and share that data. But there's a limitation to what they get to see. And you control that.
That's a great answer, David. I just want to say one thing before you go is this is the first panel I've ever moderated that they didn't say make it shorter. They said you can go for another 5 or 10 minutes. So I feel pretty good. Jack Barrett, there's a lot of pressure on you when you talk. So
Actually, let me just get a show of hands. Anybody want to see this for 10 more minutes? Anyone?
Okay.
Okay, sorry, you can't do it.
Hey, show of hands, who doesn't want us to go for 10 more minutes?
Because Google has an agreement, blockchain agreement with the British National Healthcare System right now. And they got in trouble for exactly what you were asking because they didn't get the patient consent for sharing the data or tapping into certain type of patient information they should have gotten.
Great.
And they're retracing or backing and making sure everything is doing the right thing, or whatever they're doing to fix it is being handled right now.
Yeah.
So you will see that type of, it's an evolution. So I want to say one thing. When you guys talk about blockchain, it's like blockchain. Blockchain is like Excel. Remember when you had to write accounting on those ledgers? And when you had Microsoft Windows and you can put stuff in Excel and run some solvers and programs and all those answers, totals came out so pretty and fast. That's exactly what's happening with blockchain in any industry. It's the thing that runs the things. It's not the answer to it's not a product that you will see. It's the thing that runs in the back end.
To your question, I think it could have impact on consumer-facing expectations.
Lex, get a mic.
I have a mic.
Yeah, somehow
Put it
it's
closer
not
to
going.
your mouth.
1 second, I'm going to do this.
How about that?
The internet can't hear you, and I know they want to.
Okay, so I think just, in a general cultural sense, I think our sense of what transparency is definitely going to be increasing and shaking out. I mean, there's all kinds of pressure on, tech sites and things to make it easy. Google has takeout, Facebook has the big download, and I think that's a general cultural benefit that all of this is bringing, is this idea of our data as something that's an asset, that's not just sort of up scattered somewhere, that you could actually have.
Great answer, Lexie. All right, before I take your question, do any of you have any questions for each other? Anything you want to ask?
I have a question.
Yeah.
I might have missed this, but who has ever bought a cryptocurrency in this room? Raise your arm.
You missed that.
Hold it up there. Who has actually done an ICO investment before?
Wow.
One. Okay.
2.
All right. Thank you.
3. So advice at Coinbase, not that it's the best site in the world, go to ICOalert.com, and that way you just get to see all the ICOs. it's not an endorsement for them, but it's pretty, and you can actually search by healthcare and non-healthcare. And so your question, Adi.
Hi, Adi Siegel. I'm actually working on a healthcare blockchain project. If anyone wants to talk, happy to talk afterwards. So the most disruptive companies today, like Uber, Airbnb, basically said, screw it. We're just going to do it, and hopefully it works, and it has. Obviously, healthcare is highly regulated, and also there are no regulators on this panel, or lawyers. Maybe one of you is a lawyer. What do you think can be done in healthcare by saying, screw it, we're going to come up with a better solution, and work it out in litigation afterwards?
I'm going to go back to my answer before, marketplaces. Somebody will come up and say, why don't you own your own data, and we'll blockchain your data, and you decide what you want to do with it, and you create an interface. But you're right, we're early on. It's not user-friendly yet, and it's certainly not easy to understand this. But like you guys said, this is like Excel. Blockchain is Excel, and that's how it started. Now everybody's trading it and speculative, so it gets a little opaque on what's going on.
But specifically with the law.
Yeah, well, okay, so talk about that. There's a segment where regulation runs deep, not just in the U.S., but we heard about it from the EU. China has a bunch in terms of data about individuals. Call it a covered entity, a doctor, a hospital. They have to comply with a whole lot of regulatory guidance. And if you're handling any of that data as a vendor, you have to comply with that too. All these HIPAA guidelines in terms of protecting and how that data is shared and who can access that data. Once it's in your personal possession, that's the line where HIPAA stops. So now you have this gray area when it's going back and forth. What's HIPAA? What's not HIPAA? How do you protect yourself? Most of the HIPAA regulations were designed to actually protect you against you and inadvertent disclosure of your own data, which is somewhat silly. There's a lot of good things in it, mind you, a lot of good things that need to be in there. But if you start from the person side of life, you have a lot more flexibility than when you're dealing with hospital or covered entity systems and the data that goes between those two.
Awesome.
I just wanted to add the fact that most things are in ICD-10 codes makes a big difference. That was the shift happened about a year and a half ago from 14,000 codes to 180,000 codes of everything. So it's a code-based, it's very easier to manage and mass patients identification. It's all a little more structured.
One more thing. This is not a choice between A or B, apples and oranges, blockchain or traditional solutions. Blockchain must work cohesively together with legacy systems that we have at the moment. Blockchain is not going to be the golden source of truth for the long time. It must work together with existing systems. So it's not a substitution of what we have now, but it's an additional layer.
Great. Question?
Okay, well, I think it's the last question, unless... Okay,
let's do a question, then we'll go to you.
One more before you. Go ahead.
Hi, Mal Boland, investor. Question probably for David, given his Moscow example. I'm just wondering if blockchain is, in a soundbite, the disintermediation of trust. I can wonder if in the US, where you really have very large institutions and body who benefit from the trust that they've built up and the kind of monopolistic power that they have, whether the bigger changes actually happen outside the US, where you don't have the same level of vested interest. And so I'm curious where geographically you see the biggest changes happening first.
Right now, being involved with so many different regions globally, Russia has actually become a very, very quick-moving entity in this space. They have a lot of engineers, less regulation, and they're quite good at putting together ICOs and creating innovation. So I've seen Russia doing a lot, and then, of course, the U.S. is ahead of Russia, but they have less regulations from over there. So I see opportunities happening over there. Was there a two-part to the question?
Estonia is amazing. If you haven't been looking at it, it's worth checking out. I mean,
Estonia has the
first example of like a nationally endorsed, full blockchain solutions.
We invested in the virtual identification in Estonia. So that you can actually identify yourself through a computer. The White House had a competition for a grant a year ago that we applied for to figure out, is it a possibility to do and open up a bank account online? And can we have blockchain and technology and cybersecurity solve identification online? So that goes back to the question you were in the front row were asking. The validation, the compatibility, it's an enterprise level above legacy systems right now, and it allows you to make it, micro sensitive to different legacy systems.
Awesome. I have the coolest panel ever. All right.
Very cool
You?
panel. Yeah, so I agree with what you guys said about how, like, the fact that something is built on blockchain really doesn't matter. That's
gonna start another
behind the
debate, aren't
scenes.
you?
No. But when you look back, there was Microsoft Health Vault failed. Nobody moved their data. Apple Health Kit failed. Nobody moved their data. Why are we going to move our data now?
We have smartphones now and easy integration. Most doctors have a portal now that was done about 3 years ago, 4 years ago. Government paid them $50,000 or $80,000 a year for 2 years to upgrade. And that's why and so it's been a phased
All the
program.
patients moved their data? And then all the patients moved their data?
No, it's still in little pockets, but it's a phase. Hey, damn, we can't move the mountain in 2 days or a week or a year or 10 years.
I understand, but what's
My 2 cents is personal health records will always fail because people aren't going to do that. Because there's no benefit unless I have some chronic issue I'm dealing with over time. How many times you go see a doc in the course of a year? But, having some of that data coupled with other things, when you can transact or use it in a transaction, risk score, however you want to call it, that gives you access to benefits and other things in a marketplace, that's when you're going to start caring about it. And I think this new wave of precision medicine, genome, phenome type tests, as well as digital health, will start driving data into things like that. So we may not get back into history, but we can get moving forward in time and start collecting that longitudinal record that way.
All right. Coolest panel ever. I just want to do can I do one last thing?
Absolutely.
Can we just start with Charles, work our way down? The first word that comes to your mind if you think blockchain and crypto.
Let's say transparency.
Krill?
Ethereum.
Okay.
No more unexpected bills for people, patients, healthcare bills.
Streamlining.
Wow.
Accountability.
Future.
YouTube videos.
Ah, that's true. And Alex, what comes to your mind?
Disrupt 2018. This is going to be mainstream.
There you
So,
go.
mainstream.
So, big hand for this panel.
I'd love to connect with you.
Guys, thank you, Charles.
Thanks.
Thank you, Krill. Thank you, Drew. I'm glad you joined. Lexie, awesome. Buddy,
Awesome.
great job.
Yeah.
Really interesting. Wow.
Good job, man. Awesome. And
That's the time.
Okay, that was outstanding. Thanks, everybody. That was really
I
best
have-
panel I've seen in a long time anywhere.